the COVID-19 pandemic has changed the way we live our lives, of course, globally. It is now harder to go outside, get exercise, buy things in the supermarkets or markets, and carry out day-to-day activities normally.
It was always harder to get exercise anyway before. But here in Nigeria, apart from maintaining a very high level of hygiene, the wearing of face masks have become a vital part of staying healthy.
Well, joining us now to look at staying healthy during the COVID-19 pandemic is Dr. Olumuyiwa Olusanya, a member of the Technical Committee of the Health and Managed Care Association of Nigeria and CEO of Health Partners. Dr. Muyiwa, if you can hear me, welcome to the morning show. Thank you for joining us. Now, like we rightfully said, now that there's been an ease in the lockdown, wearing of face masks in public, hand sanitizer, washing your hands, these are little steps that we can take to make sure that we are healthy. And even when we had the Commissioner of Health for Lagos State, Professor Akin Abayomi, he said, you know what, trying to boost your immune system is very important, and the best way to do that is to rest. So tell us, Dr. Muyiwa, what, in your opinion, is the best way to stay healthy during this pandemic?
Staying healthy is looking at health from all the areas, looking at health from a point of view of social, looking at health from a point of the mind, looking at health from also physical and also spiritual well-being. So staying healthy, you have to be able to balance all these areas of life and make sure that you have the good outlook at the pandemic. Talking about the mind was make sure that we have a good outlook, which is positive towards the pandemic, making sure that we have, as much as possible, try to free our minds from fear, focusing on what is positive about the pandemic, what people are doing to save the day, what people are doing to contribute to make sure that we get out of this challenge that we're in, focusing on success stories and good news about discoveries and things that are being done for people that are recovering and people that are doing well. Also, for people that have lost a loved one, they need to also grieve properly. That's also part of staying healthy, to make sure that they're able to face the challenge and overcome it and stay healthy and not go into depression and other forms of challenges that can occur with mental health. Talking about physical health, I believe that exercising is one of the ways to actually maintain your health and also boost your immune system. But one has to put a balance to it. People should not try and be trying to overdo it at this point in time, because at the same time, we're supposed to be adhering to social distancing rules and making sure that we avoid physical contact as much as possible. So some people actually were cautioned trying to exercise in public, going about in groups and all that. That is not encouraged at this time because it's against the social distancing rule. One can, however, exercise moderately. You can exercise in your home. There are things that you can do, there are aerobic exercises you can do on your own without stepping out of your house to exercise. So there are things we can do at home ourselves to actually keep our body fit, but we should do it moderately. We should not try and do it in a bit to try and feel that by exercising more, you'll be able to fight coronavirus better. So I would say people should do it moderately and they can keep to their homes. They don't need to go out in groups to do that. But moving on, there are other things we can do. We can eat healthy. Eating balanced diets, taking foods that are rich in vitamins and vegetables, and so that we can get all the nutrients that we need that can help to boost our immune system. In addition to that, I would say we need to take care of our physical health. For people that have chronic diseases that they're currently managing, diseases like hypertension, diabetes, and other chronic diseases, this is the time they need to actually make sure that all those diseases are properly controlled. They need to make sure that they are seeing their doctors and they are taking their maintenance medication as regularly as possible. This is the time for people to actually ensure that they have a health insurance plan if they didn't have that before, to ensure that their health is well maintained and they won't have reasons to actually go into some form of financial risk as exposures to health challenges can come at this time. So in a nutshell, I would say that keeping healthy, eating well, balanced diet, food rich in vegetables and fruits where we can get a lot of vitamins, that can help to boost our immune system. Resting well is also very important. You need to rest properly to energize, to restore your body on a daily basis and make sure that your immune system is optimal at this time.
Right. I just want you to, expatiate on the aspect of mental health. I mean, what people can do to stay mentally healthy, because once you lose your mind, you lose everything at this season. And also, maybe with direct emphasis on those grieving.
Yeah.
I mean, we've got a lot of lives lost.
Yeah.
Take, for instance, what do you tell those families that lost their loved ones in Kano? I mean, how do they grieve? And they have to move on so quickly. It's quite painful.
Okay, well, it is a challenging time. My heart goes out to all the people in Kano that have lost a loved one. It's not easy to bear this at this time. And it's good to say that all the people that have been exposed, that have passed on, it's not that they were careless, it's not that they were nonchalant. It was just unfortunate that it happened and they had the outcome, ended up like that. So people should not have that mind that, oh, maybe they were careless or they did not wear face masks, they did not do social distancing and things like that. That may not be the case. But my heart goes out to all of them. Our condolences goes to all the families that are involved. But I would say that at this time, the best thing to do is to stay connected to family and friends, to get the support they need at this time, to be able to grieve elderly. It's not easy to lose a loved one, more so when people know that this could have been prevented if there was a drug, if there was a vaccine. But unfortunately, they don't have that resource at this point in time, and it's not their fault. So they need to stay close to family and friends. They may need to get some professional help, to get some support to make sure that they can grieve healthily.
All right, Dr. Olusanya, two things you said earlier I'd like to touch on. You talked about diet. Lots of people are stocking up during this period. We do know that there's no magic pill to boosting the immune or to treating COVID-19. But are there things that we shouldn't be eating at a time like this? And you also touched on insurance, that those who don't have insurance, this is the time to get insurance. Well, the World Health Organization, during a briefing yesterday, raised some concerns about African countries now relegating other diseases such as malaria, tuberculosis, and HIV and AIDS just to fight COVID-19. I wonder what has been the responses for patients who want to access care at a time like this, because I do know you belong to a body, an umbrella body for HMOs in Nigeria. I would like you to comment response to those answers, but I would interject for a break and a couple of okay, I've been told we should just take that break now, Dr. Olusanya. Okay. So we'll come back and we'll discuss some more. Please stay with us. Welcome back to the Morning Show here on the Rise News. Dr. Olumuyiwa Olusanya, a member of the Technical Committee of the Health and Managed Care Association of Nigeria, as well as the Chief Executive Officer of Health Partners, is with us discussing how to stay healthy in this time of coronavirus pandemic. Thank you so much, Doctor, for staying with us. So let me reiterate my question before that break. What are the things we should not, we talk so much about what we should be eating. What are the things we should not be eating as regards diet at a time like this? And you also mentioned that this is the time for Nigerians to come on board insurance. When it comes to COVID-19, which is an infectious disease and a pandemic, we do understand that the government is taking care of the bills because it's like a force majeure and you cannot have insurance for that. But the World Health Organization is saying a lot of people are not accessing care as regards other diseases such as tuberculosis, malaria, HIV and AIDS. I wonder what the complaints have been in recent times, because you are a member of that umbrella body for HMOs. So tell us.
Okay, I'll go first on this one you just mentioned. Yes, it's true that in a way, there's been so much focus on COVID-19 because of the urgent nature of the disease that has taken everyone globally. And so there's some form of distraction because of the attention of COVID and because it's actually have been killing people. Now, the truth about it is that we still have malaria, we still have hypertension, we still have diabetes, we still have all these diseases with us. They have not gone away. So we must ensure that people still continue to have access to care for the diseases that we still have with us that are not going to disappear also. So and this is where health insurance comes in. We want to be able to ensure that people continue to access care safely at the hospitals despite the risk of COVID-19 because we cannot ignore all those diseases. They are also killing people. So we need to be able to address these concerns and make sure that access to care for all these common diseases is still optimal at this time. Also, there has been some innovation in the space of healthcare in the last couple of months, and people are also using telemedicine to access care for things that they don't need to physically visit the hospital for. They can get consultations done online from where tests can be prescribed. They can go and run the tests, and when the results come back, then they can visit the hospital if they need to visit the hospital. But we do know that there are a lot of people that are undergoing on treatment for a lot of chronic diseases like hypertension and diabetes, but diabetes in particular, because it has a way of weakening the immune system, is not properly, the blood sugar is not properly controlled, and this needs to be properly taken care of. We also have other conditions like asthma, which can actually be a challenge for people that may be exposed to COVID-19, because COVID-19 has some respiratory, of course, distress as part of its manifestation. So we need to make sure that we are taking care of all these diseases that are already existing with us. People should not be, because of COVID-19, stop accessing care at the moment. They should continue to access care with their provider, but they should do so safely. The government has gone on to ensure that we all wear masks to make sure that we reduce the risk of spreading or contacting COVID-19. So I employ everybody to wear the mask. They should visit the hospital whenever it's necessary. People that are on chronic medication, on chronic treatment for diseases like hypertension, diabetes, asthma, and other similar diseases should ensure that they see their specialists as when due, and they should go to the hospital when it's necessary. They should use technology where necessary to make sure that they're in touch with their provider, they're in touch with their hospitals. So like I said earlier, because of all this, we should not shy away from treating what we know that exists, that is still with us. And this is the time for everybody to embrace health insurance, to make sure that we all have access to care for all these diseases that are still with us. For COVID-19, very soon, we will have a drug, we'll have a vaccine, and we can all have access to those treatments when it comes. But for those diseases that are still with us, we should ensure that we have access to care. People that don't have health insurance, this is the time to make sure that they get a health plan and make sure that they reduce some form of overexposure financially to a catastrophic cost of treatment, which may occur from all these diseases I've mentioned, even apart from COVID-19. Now, talking about diet, talking about what we should not eat, there are so many things that we should not be eating, but I may not be able to explore all of them. But the truth about it is that in the social media, there are a lot of things, a lot of information flying around about what works, this is what somebody used, this is what they are using to treat COVID-19. You drink lemon, you drink garlic, you eat this, you do that. So a lot of fads, a lot of things that are proven that people are just sharing on social media. There are even instances of people that are claiming, people that did not have a test done, that did not actually have any tests done for COVID-19, no confirmation. They are saying that they got treatment, this is what they used and all that, and people are following them. So we need to be careful of all these discussions that are going on social media that is not coming from a healthcare professional advising you on what to eat, what to stay on. I would just say generally that we should eat balanced diet. We should focus on eating foods that are rich in vegetables, and we should take a lot of fruits because the focus is to get a lot of vitamins, which we know will be able to boost our immune system at this point in time. as much as
Okay,
possible.
If you can hear me, Doctor, you have
Yeah.
spoken about, I mean, we know that there's no cure or vaccine for COVID-19.
Yeah.
However, there has been a huge push for natural remedies. So speak to me about, the Traditional Medicine Board. Is your company working with, any traditional medicine committee? We do know that we have a huge ecosystem of plants and herbs, so we're not tapping into it.
And just to quickly add to that, the case of Madagascar, Rajoelina, do you think we should support alternatives like that, traditional alternatives, despite the fact that it's not been empirically tested? Because Congo has just got on that drug. A couple of other countries want to take that drug. And the science board in Madagascar is complaining about that drug and is calling on all of us to be careful as regards that.
Yeah. We all need to be careful about taking drugs that have not been authorized by the right agency. For example, in Nigeria, NAFDAC has the authority to approve any medicine for use. So until NAFDAC says that a drug is safe for use, I won't advise anybody to take that drug. Well, we know that, yes, that we have some herbal remedies that may work. They have some vitamins, they have some things, some active ingredients that may work. They need to be subjected to tests, scientific tests, to ascertain the potency of those things and what actually they contain and the right dosage for them. And that should be routed through NAFDAC. Once there is the approval from NAFDAC, then everybody can take it if it's safe and is scientifically proven to be able to address COVID-19. So my take is that, yes, there's nothing wrong with herbal, but it has to be proven to actually do the work. And the regulatory body that has the authority to do that must give a go-ahead for the use of that. Yeah.
Well, the other part of the question Shaitan asked you was if you are partnering with Traditional Medicine Association or practitioners.
No, my own association is not currently partnering. Whatever, we'll be willing to explore any partnership in line with NAFDAC guidelines and approval. If NAFDAC is willing to look at what they are doing and it can be scientifically proven that those drugs or remedies do work, yes, I'm sure medical practitioners will actually follow directive from NAFDAC and take action on that.
Well, that's a good place to leave it. Dr. Olusanya, thank you so much for coming on the morning show today. We really do appreciate it.